Hey, Dr. Derek Nielsen here, the owner of Kaizen Physical Therapy. Today I want to talk about sciatica. This is one of the things that we see most often from clients here in the clinic. And honestly, the far majority of the time, it's misdiagnosed as the cause of where your sciatica is coming from. So I want to uncover that. But first, let's talk about what is sciatica. Now you have what is called a sciatic nerve. It's the longest nerve in the body, and it comes from the lower spine here, and it goes all the way down your leg, the back of your leg, and it goes down into your feet. Now you have two of them. You have one on the right and one on the left. Sciatica symptoms are a sensation of tingling, numbness, burning, or oftentimes people will say that they feel a sensation of pins and needles. Now it must be present in the back of the leg. It doesn't necessarily have to go all the way down to the foot. It can go as far as the back of the knee. It can go as far as just to the buttock area. Oftentimes people say they do feel a sensation down in their feet, but again, that's not required. Now what sciatica is not is a pain in the back of the leg or a dull ache in the back of the leg. That is a muscle referral pain and is something that we can diagnose when you come here into the clinic. But again, sciatica is tingling, numbness, burning, or pins and needles. Now I'm going to tell you something you've probably never heard before. And this is coming from new research as well as myself helping people just like you that have sciatica, is oftentimes the diagnosis that somebody comes to me with isn't the cause of their sciatica. Now what I mean by that is the far majority of people that I see here in the clinic that come in for sciatica have told me that they've been diagnosed with a herniated or a bulging disc in their low back. Now, new research has come out and showed us that, did you know people in their 50s, 36% of them have a herniated disc. And these people have no pain, absolutely no symptoms, no sciatica, no back pain, but yet 36% of them have a herniated or a bulging disc. So what does that mean? It means that a herniated and bulging disc is completely normal. Absolutely completely normal. It's similar to having wrinkles on your skin. As we age, we get wrinkles on our skin, yet the wrinkles don't hurt. You age on the inside as well, and it comes in the form of herniated and bulging discs. Now I want to show you a couple of simple tests that you can try if you've been diagnosed with a herniated disc to see if it's the cause of your sciatica. But first, let's talk about the second most common diagnosis that we hear in the clinic, disc degeneration. Did you know that if you've been diagnosed with disc degeneration, those same people in that new research that I was talking about, 80% of people over the age of 50 have disc degeneration. But yet again, they have no pain. So again, what does that mean? Is it's completely normal. I promise you, it sounds counterintuitive, but as we age, the inside of our bodies age just like the outside. Oftentimes what you find on an x-ray or an MRI is not the cause of your sciatica. So let's jump into those simple tests that you can try. There are different ones for a herniated and bulging disc, and there's different tests you can try if you've been diagnosed with a degenerative disc disease. Now first, let's go over the simple tests that you can try that we do with our patients here in the clinic if you've been diagnosed with a herniated or a bulging disc as being told it's the cause of your sciatica symptoms. Now I will preface this with, this is just part of us finding the root cause of your symptoms. This is not in any way the only thing that we need. This is just part of finding where the cause is. Okay, so what you'll do is go ahead and stand on up, and all you're gonna do is go down and try and touch your toes. Now let me ask you, when you're down in that position, did that increase your symptoms? If there is no increase in sciatica symptoms, it's unlikely that a bulging or a herniated disc is causing your sciatica. The other thing I want you to try is a child's pose. So you'll get down on your hands and knees here, and then all you're gonna do is lay back and just hang out there. The key with this one is relax. Relax as much as you can. Did that increase your sciatica symptoms? Again, if it did, then there is a chance that the herniated disc is the cause. If it didn't, there's a high chance that the herniated disc isn't even causing your sciatica. All right, the test for degenerative disc disease, if you've been told that's the cause. Now first, let's talk about this. Degenerative disc disease, if it's the true cause of your sciatica symptoms, you should have sciatica down both legs. The way that the spine works and the way that this works, that should be the case. If you have sciatica down one leg and not the other, degenerative disc disease is not the cause of your symptoms. However, if you have them down both legs and you've been diagnosed with degenerative disc disease, try this simple test. All you're going to do is stand up. You're going to put your hands on your hips, and I want you to arch back. Does that increase your symptoms? If the answer to that is no, degenerative disc disease likely isn't causing your sciatica. The other way you can do that, because sometimes that test is a little bit painful, is you'll do this lying on the ground. Okay, so you'll come down, you're gonna go flat down on your stomach, and then you're gonna take your hands here, and you're gonna press up and try and really relax through this movement. Does that laying there like that increase your symptoms down your legs? If the answer to that is no, then it's extremely unlikely degenerative disc disease is causing your sciatica. So I need you to understand how important it is to get the correct diagnosis. And if you don't get the correct diagnosis, it leads to needless suffering. I hear the story all the time where people come in and they've been taking pain medications. They've had many cortisone injections, even epidural injections for their sciatica, and unnecessary surgery because they're told the cause of their symptoms are herniated bulging disc, degenerative disc disease, and they're actually not even the cause. So we have to be certain of where the cause is. I gave you 2 simple tests that you can do. I also, here at Kaizen Physical Therapy, to make sure that we know where the cause is, there's 3 things we do. 1, we listen to your story. When did the pain start? Was there an injury or did it come on gradually? Likely if the pain came on gradually, the herniated or bulging disc, the degenerative disc disease was there before the pain ever started. And that means it's coming from somewhere else in your body. Questions such as, what makes it better? What makes the pain worse? Again, when did it start? Those are the questions that are going to start to identify where the root cause of the sciatica is coming from. Then we complete the story by looking at how you move. What movements make the pain worse? What movements make it better? What movements in your body aren't moving the way, what areas in your body aren't moving the way that they should? Because here's what we realize. Oftentimes the area that hurts isn't even the cause of the pain. The area that hurts usually is compensating because somewhere else in the body isn't working like it should. We realize that even though somebody has sciatica, we have to take a full body approach. What I mean by that is we have to look at the back, we have to look at the hips, we have to look at the knees, and we even have to look at the ankles. Because the area that's not working like it should often leads to a compensation somewhere else in the body, and that area that compensates is the area that hurts, and it's not even the problem. We finally complete that by laying our hands on you. By doing that, we can find what areas are tender, what areas are tight, and what areas are referring pain into other areas. What I mean by that is oftentimes the hip, the back of the hip here, will be the cause of sciatica. But we don't ever know that if we don't touch you. Sometimes the low back will cause it. We don't know that if we don't touch you. So we have to listen to your story, we have to look at movement, and then we have to lay our hands on you. By the end of that, we are certain where the cause of the sciatica symptoms are coming from. Now listen, if you're interested in finding where your root cause of sciatica is, we offer something totally unique here in Durham. We offer a completely free, no-cost consultation visit. We call it a discovery visit. It allows you to come in and sit down with myself. It's about 45 minutes in length, and I guarantee by the end of that visit, you will know if I can help you. If you're interested in setting that up, go ahead and click the button below, fill out the quick form, and we'll get in contact with you and get you in for that free appointment. If you're not interested in that, what I would recommend is you start by downloading my book. You can hit the button that's below that and start by reading the book. It will open your eyes up to science. It'll open your eyes up to the root cause of sciatica. It'll also help you identify how we help people here and get them back to being active, pain-free, and mobile without ever taking pain medications, injections, or any surgery. Well, I look forward to talking to you soon. Thanks so much.